Hello and welcome on behalf of the American Psychological Foundation. And thank you for joining us for this APF Home Fireside Chat. This is the final chat honoring the 2023 recipients of the APF Gold Medal Award for Impact in Psychology. I'm Dr. Gayle Beck, APF Trustee, and I'm thrilled and delighted to be here today with one of our recipients, Dr. Jillian Shipherd. As the premier private grant-making foundation in psychology, APF awards over $1 million annually in grants, scholarships, and awards supporting psychologists and students who are using psychology to address major issues and improve lives. APF is unique in that it receives the overwhelming majority of its funding from individuals like those of you who are joining us tonight. We cannot express enough gratitude for your investment in APF and the important research that we continue to fund. Just a note, as we proceed through this chat, which Jillian and I will turn into a conversation, if you have any questions for Dr. Shipherd, please feel free to enter them in the Q&A feature, which is found at the bottom of your screen. We'll do our best to answer all the questions at the conclusion of our chat. It's now my absolute pleasure to formally introduce Dr. Jillian Shipherd. Dr. Shipherd was awarded this honor in recognition of her extensive work to improve the lives of LGBTQIA+ veterans. She has pioneered national training programs for the Veterans Affairs healthcare system on all facets of transgender healthcare to support policy changes and improvements, positioning clinicians to evaluate and treat this ignored population who often is stigmatized. Her research has received wide attention in the media and from senior management within the VA healthcare system. Dr. Shipherd has taken her research findings and applied them to make truly groundbreaking changes throughout the VA, spanning both education, care, and policy. Her trailblazing work has had a transformational impact on the lives of LGBTQIA+ veterans and will continue for years to come to affect access to care for generations. Welcome, Jillian.
Thank you so much. I'm thrilled to be here today, and it's even better to be here with you. So thank you so much for doing this chat with me.
You know, I always like to chat with you. That's never an issue.
It's stopping us that's going to be the problem, I think.
So, Jillian, let's get down to work here, right?
Yeah,
This
yeah.
always happened. Yep. As your graduate school advisor, I'm very familiar with the training that you received during your doctoral work. Your training was really traditional and it focused on psychopathology, assessment, and treatment. I don't recall any part of your training that focused on LGBTQ plus health. Can you tell me how you went from being a trauma-focused psychologist to someone who not just specializes in LGBTQ plus health, but has transformed an entire healthcare system?
Well, it's kind of a big question, but I would like to say that the fields of trauma recovery and LGBTQ plus health really aren't all that far apart, sadly. Due to the high rates of trauma and discrimination in the LGBTQ plus community, the two fields are really very much overlapping. And you're right to point out the deficit in my early training, because even decades later now, there's very little professional training in LGBTQ plus health. As just an example, an illustration of the gap in education, I'm a bisexual cisgender woman, and I had no idea until like 10 years ago that being bisexual puts me at increased risk for several health conditions, including some cancers, substance abuse, interpersonal violence, and obesity. Of course, I knew that there was stigma and discrimination because I've experienced it, but my own identity wasn't actually what drew me to working with LGBTQ plus health. It was actually the clinical work that I was doing at the VA and seeing the resiliency of the transgender women veterans that had me hooked on the topic area. Very early in my career at VA, working in a women's trauma clinic, the director sort of offhandedly said, we have about a dozen transgender women in our clinic right now. We should probably offer a support group for them or something, and of course she was right. And being the new kid on the block, I, of course, volunteered very eagerly. And then because you trained me so well, I said, oh, well, I need to go to the empirical literature and find out, what can I be doing that's evidence-based, that's really going to help folks and get them to where they want to be. But unfortunately, I really didn't find much. There was one article from the late 1980s by Dr. George Brown, he's a psychiatrist, and really he was a pioneer in transgender veteran care. And I'm pleased to say now also a friend. And his work really gave me a place to start. But more than anything, it was the veterans who I co-created the support group with that I really need to give credit to. I wanted the group to be a place of healing and growth. And so, I worked with them to figure out what that meant. And then later, I published a paper about the support group so that there'd be something in the literature for the person who is coming behind me to use as a guide or just a reference, a jumping off place, really. And I have to admit also that I made a lot of mistakes in those early days and still continue to make a lot of mistakes, quite frankly, but yeah, that's how I went from there to here.
Well, we're really glad you did. And mistakes can also be important learning experiences. Um, can you give us an example of a mistake that you feel you really learned from?
Yeah, I'm not shy. I'll talk about whatever you want to talk about, and mistakes included. I would say a big problem in the transgender community is misgendering. So when people purposefully or innocently use the wrong pronouns, it hurts just as much, whether it was intended harm or no harm was meant by the person who used the wrong name or pronoun. So to address that, back in the early days, I would take my veterans down to the clerks, the check-in clerks, and I would basically just bully the clerks into changing the M in their medical record for male to F for female, because it felt like the right thing to do. And, we'd walk away from that meeting with the clerks, high-fiving each other and feeling really good. But of course, what I didn't realize is that there's a process for changing medical data. There's a system, and of course, being the government, there was a form that we needed to fill out, and I wasn't following the right procedure, so that data that I had gotten changed would get changed back automatically. So it was a really important lesson for me to learn about policies and procedures of my system so that the changes that I was trying to make could really be lasting. So I guess I would say to folks out there, if you follow the right procedure to improve something or to institute a new policy, that has a much bigger impact than, just trying to bully your way through what the changes that you want to make.
For sure, for sure. Many of us who are familiar with the VA healthcare system and the VA administration at large completely marvel at the positive changes that you've been able to spearhead in terms of improving the quality of care, training clinicians, policy work. When you think about the work that you've done, what do you think are the most salient parts of this?
I guess I would say that, change often happens because there's just a few people who are really pushing things forward. And I had a lot of great people working with me on all of those changes that you just mentioned. And I'm still working with a lot of folks on future changes. And there's way too many of them to list, but I do want to give a special shout out to Dr. Michael Koth, who I have collaborated with on all of the changes that you just mentioned in the VA, who's been a phenomenal leader and a phenomenal partner in change. I don't think any of these things would have happened without his support and without his collaboration. But to answer your question more directly, I think the most salient part of the change is that we've been making systemic change, because institutional changes will outlive the creators, right? That's the goal. So what Michael and I have been trying to put in place is multifaceted change. So we started with policy sort of as a cornerstone, as something to really layer the other changes on. But of course, anytime you change a policy, you have to make sure there's education for staff and providers about the changes, what's expected of them, why are we changing the policy. I think that helped us move things forward because we were trying to communicate what was going to be different for them and why. And so that was a really solid foundation that I think we were able to make. And now another really big new change in our system is that we're gathering sexual orientation and gender identity data, which is going to be super important for guiding clinical care, and also to help us understand sort of at a population level what the unique needs are of our LGBTQ plus veterans, and not just as a group, but individual letters in our big long acronym. And of course, with all of this change, it's really important to remember, change is never easy, change is hard. So it's really important that we put in place support systems for both veterans and providers. And so on the veteran side of things, the support is through our LGBTQ plus veteran care coordinators. We have those at every VA facility in the country, and they're really the boots on the ground, points of contact for veterans. So they can get them fact sheets about their unique health needs, answer any questions that they have, those kinds of things. And those folks are also supports to providers, because a lot of times providers are looking for education and they're not really sure exactly where to go. So the LGBTQ plus veteran care coordinators can direct the providers to our online education tool, which has all of the trainings on different aspects of healthcare. So, for example, a provider could take a training on how to deliver hormone therapy for gender affirmation, which is great. But then when you go to apply that education to a unique veteran, and that veteran has a bunch of medical conditions, and you're not exactly sure how to apply the information that you learned about, we also have a nationwide e-consultation program on transgender health. So any provider anywhere in the country, any discipline, if they have a question about the treatment plan, they can ask a question through the veteran's electronic medical record, and then it goes to experienced interdisciplinary teams of providers who can answer the question, not just generally, but specifically for that veteran. And so when the veteran consents to us being able to do that with their electronic medical record, I think their care is just vastly improved. So I think that's been great. And of course, when we're talking about education, probably of interest to this audience is we have 10 LGBTQ plus health postdoctoral fellowships for psychologists at various VAs in the country. And what I love about the fellowships is that we're really building a pipeline of folks to continue the changes that we've started in the VA. So that's really exciting for me. It's sort of strategic planning for me and thinking about succession planning.
Yeah, exactly. Exactly. And so very smart.
Thank
So
you.
very, very smart. My next question, I think you've already kind of answered. But let me throw it out there and you can tell me I've already answered that. Your work has been instrumental in establishing training programs for VA staff. I'm assuming that's physicians, psychologists, social workers, the whole gamut. Um, how have you ensured that these training programs effectively translate across VA facilities? And that includes, VA facilities in states where, um, it's not legal to have a drag show, for example, where I live.
Yeah, yeah. No, it's so true. And when you think about it, we're a national healthcare system. And the implementation of a policy can look really different from place to place, as it should, because what works here where I am in Boston, Massachusetts, probably won't work for you in the same way where you are in Memphis, Tennessee, or in rural Kansas, for example. And so again, I'd say it's really helpful to have our LGBTQ plus veteran care coordinators at each facility, because they're the eyes and ears of our program, and they know what's happening locally. They know about the drag bans and other, state-based challenges that folks are experiencing, and they know what the unique challenges are for that facility, so they can help the providers find the education that they need, and they can help the veterans know that even though there's a ban on X, Y, or Z in our state, here at the VA, you will get gender affirming care or whatever it is that they're looking for. It's still a scary time for a lot of folks, though. So it's important not to underplay how scary it can be in some states. But at least we have policy on our side here in the federal government.
Yeah, and not only that, but I think it's important that to acknowledge that the VA being a federal institution is somewhat, there's a buffer in
Mhm.
terms of where state laws can intrude.
Yeah.
And that's actually kind of a magnificent thing sometimes,
Yeah, no, definitely. It's very helpful. Providers can be scared to provide care if their state is, restricting access to healthcare. But because we have this federal system that they're working in and they're following the guidance that we're asking them to follow, we can back them up for
Yeah.
providing that care.
These changes have taken many years, and I've been fortunate to sort of follow along in the course of all of this. These changes had to be sort of dreamed up, envisioned, thought about ways to devise them and implement. Um, can you give us an overview of some of the process that went into designing and implementing? And I say that because, there's people who want to implement change in recalcitrant systems. And, this is sort of the how in the world did you do this question, right? What, what were some of the processes that really worked for you?
Yeah. Well, definitely know your system. That's my first piece of advice. But taking sort of a continuous improvement stance is really important. It's great to have a big, lofty vision. Certainly, I have many big, lofty visions. I have had them and I continue to have them. But you can't execute on a big, lofty vision. It needs to be broken down into smaller, more manageable parts. Otherwise, you'll just get overwhelmed or, sucked down some rabbit hole trying to figure out a process that maybe isn't the most important piece of what you're working on. So, so definitely breaking things down into smaller, more manageable parts is really important. And then making sure that you're collecting the right outcome data to build a case for continued investment in your plan is super important. If you can't show that something's working, then you're not going to have the institutional support. I mean, people just aren't going to back you. Even if it's a great idea, if you can't show them, like, this data point moved from X to Y, why would they continue to invest in that program? And it's important to remember that leadership can be swayed by lots of different kinds of data. So it could be clinical outcome data, like, when we provide support to LGBTQ plus veterans, the likelihood of them having suicidal ideation goes down. That's a great outcome. Or it could be cost saving data, like when we provide comprehensive gender affirming care, there's not a lot of extra visits that folks have to come in for. Or it could be access improvements where we're making sure that rural veterans have access to certain kinds of care through telehealth. We're doing that with speech language pathology right now, which we can talk about more in a minute. But so I guess, also remember what's important today to your leadership could change. So what's important today might not be as important 6 months from now. So tracking a variety of outcomes is important so that you have data you can convince them with. Also, you don't know exactly what measure is going to be, the one that shows the most change at the start. So having a few options is important. So the way in which we were able to achieve this is by making sure we had a diverse team of folks helping us build each of the changes that we were making, because we had a lot of different voices represented, a lot of different perspectives, so that we sort of we were able to anticipate what some of the questions might be about the different projects that we had. And, really be realistic about the fact that every project has costs and benefits. And, even the best of ideas, sometimes the costs are too much. And so you need to really always be, like I said, this continuous improvement mindset of looking at things. How are they going? Is this something we want to double down on? Is this something that we want to move away from and focus on something else that's more important right now? So it's really just a matter of having a clear change management focus and following your data. That's what you always taught me. Pay attention to the data. They're going to teach you where to go.
What a beautiful blend of science and policy. I mean, you've been involved in various policy initiatives, including serving on the White House's Interagency Working Group on Safety, Opportunity, and Inclusion for Transgender Individuals. I did not name that committee. It would be far shorter if I had named it. You've already talked a little bit about how you navigate using data in a policy framework. But there's more that goes into this, and it's sort of that intersection of psychology, advocacy, and public health. Can you talk a little bit about navigating those different spheres, because they work really quite differently?
Yeah. Each of those disciplines, they have unique theories and unique approaches, but in my sort of big picture framework, they're ultimately very similar. I find that the buzzwords for the concepts are just different. You know what I mean? And so if you just use plain language about what you're doing and your plan for how you're going to get there and what you need, I think it can be pretty easy to bridge the gap between disciplines. Every once in a while, you'll bump up against somebody who's, using words that, you're not understanding what they're trying to convey, and you just need to ask them, like, can you explain, what are you trying to tell me here in plain English? Fortunately, because I was trained in the scientist practitioner model, we learn in that model how to take theoretical conceptualizations for change, how that underpin the therapy that we deliver. And also, we learn how to explain the theory and the change mechanisms to clients. So we already know, this, I don't know, translation language in clinical psychology. We already do this because, you have to explain things to your clients in ways that they can understand. So I think that training really helped me sort of bridge the gap between, psychology, advocacy, public health, and some other disciplines too.
For sure. And to not get caught up in, buzzword bingo, it sounds like.
Well, don't forget, I work in the government, so there are also acronyms that you have to figure out too. There's an acronym for everything.
Yeah, the government is probably one of the best acronym generators that I've ever seen. You know, can you give us a glimpse of how your life experiences have informed your professional work? And if that's me being kind of too nosy, just tell me and we'll go on to something else.
I'm an open book. It's totally fine. Um, you know, as you know, I have a tiny taste of what it feels like to be an outsider, or what other people consider to be an outsider. And that has really helped inform my sense of empathy for marginalized communities. Even as I'm saying this in my head, I'm like, wait, I need to name that I also have great privilege as a cisgender, white, well-educated person. My privilege needs to be named, and I need to acknowledge that it has really helped me in the world. And at the same time, growing up on food stamps, being bisexual, being a punk rock young adult, it gave me windows into other worlds. And these were worlds that I knew I wanted to make a difference in.
Yeah, you know, I'm going to show a couple of slides because
Because
I
you
just
can't help
have to.
yourself.
Can't help myself. Um, when I look at Jillian in her early days on the left, and then I look at you the night you were receiving your award, for me, this validates the fact that there's room in psychology in our field for all of us. And now I can't get the slideshow to move. There, this was such a sweet picture of the two of you. You were just glowing,
Yeah.
and your partner is glowing for you. And, I think it's often people who have experiences that differ from the mainstream who understand at a really deep level the importance of harnessing the power of psychology in its application. Um, and so, no, I didn't do that to embarrass you, but I just want in our chat, I just want people to understand that, you don't have to be someone you're not
Right.
in order to have a powerful effect in your work. And you can define your work any way you want. That's the beauty of psychology.
Yeah. Yeah. I mean, when I started as a baby psychologist, LGBTQ plus health wasn't even a field. Like, it didn't even exist. My job that I do now didn't exist. So you can make anything you want to have happen, really, if you work hard enough. But I'm glad you showed that picture of me and my life partner too, because I think it really helps having someone by your side, or someone's by your side, if that's your preference. It really does help to have that support at home. It really makes a difference.
Yeah, and he's pretty magnificent, actually.
Yeah,
Yeah.
he is.
So you mentioned speech language work. So I'm going to get us back on track so we stop like inflating your partner's ego. Although if he's listening, I'm sure he's having fun with this. Um,
Oh, he is.
yeah, yeah. Can you tell us a little bit more about um, how expanding non-psychological services, but needed services, what kind of impact has that had, especially like for veterans in rural areas or for veterans who maybe have mobility problems?
Yeah,
Um,
yeah. Now, you're referencing our program in speech language pathology, and this is a partnership with a clinical program that oversees the speech language pathologists in the VA. And I think everyone on this call realizes that voice and communication skills are really at the heart of how we're perceived by other people. And so this can be a really essential part of treatment for transgender and gender diverse folks. And unfortunately, about 5 years ago, we realized that really not many people at VA knew how to do gender affirming voice and communication treatment. And we couldn't just send our veterans to the community to see providers out in the community, because especially in rural areas, that expertise just didn't exist. So I'm really proud to say that we have now trained 32 speech language pathologists in the VA using a data-driven treatment approach. And perhaps the best part of the whole thing is that they deliver the care right to the veteran's home by telehealth. And so they can treat anyone anywhere in the country. And if they don't have internet, because a lot of places in the country, believe it or not, even these days, they don't have internet, we send them an internet-enabled tablet to be able to do the treatment on. So it's pretty exciting work, and I'm very proud of that partnership with the speech language pathology folks at VA. They're
that's
really,
really remarkable.
yeah, they're really changing lives.
That
It's
is really, really remarkable. And you're reaching people who, I don't know, live in the boonies or people that have a hard time mobilizing themselves into a VA hospital,
yeah,
and I think that's essential.
yeah, and also people who are scared to come into the VA. They're afraid when they walk in that they're going to be harassed and discriminated against. So if they can get the healthcare at home where they're safe, they can really, I think benefit the most from the treatment that we have to offer. And of course, we're addressing environment of care as well, because ideally what we want is for veterans to feel safe at every VA facility, to make sure that they know they can come to us, they can use the restroom of their choice. It doesn't matter what those state laws are. They can come to the VA, they'll be housed based on their self-identified gender identity. We really want to support them in making sure that they're living their best lives. And that's true for all veterans, but also LGBTQ plus veterans, because they're veterans too. People sometimes forget that piece.
For sure. Yeah. What advice do you have for psychologists who themselves are interested in advocating for and providing culturally competent care to marginalized populations?
First thing I would say is make sure your self-care strategies are in place. You need.
Okay, I'm going to interrupt here
Okay.
because I remember you in graduate school and self-care was not high on your list,
Hmm.
to the point where I sometimes would like come to the lab and say, you need to go home now.
Hmm.
And you would say, no, I need to do this. And then you and I would argue and I would lose and leave. But in the last, I don't know, 10, 15 years, you have found some wonderful ways to take care of yourself while you're also creating a beautiful world. You've started gardening, which just makes my heart sing. And I never would have guessed that. And I know that you and your partner often travel to pretty fabulous places. So I I'm just really impressed that Jillian Shipherd, who I never thought would buy into the concept of self-care, has developed some really, really spectacular forms of self-care. And I know here I am calling you out again, but that's part of my job.
That's
But
okay, you're good at it.
I interrupted you. You were sharing your wisdom for other psychologists in advocating for and providing culturally competent care to marginalized populations.
Yeah. Um, I do have to again acknowledge though that Sinisha, my life partner, is really sort of the angel on my shoulder and is the one who has helped hold my feet to the fire in terms of taking care of myself consistently. I'm somebody who lives with a disability. I have a chronic illness, as you know. I have multiple sclerosis, and I've had it for a very long time. And if I don't take care of myself, you know, the end effect would be bad. And so he has absolutely been, you know, the voice of reason, I would say, and he's the one who now comes and says, you need to stop working now. It's not you anymore, it's him. So there's always somebody in my life who's trying to help me take care of myself. And so definitely that is huge. Okay, but so find a great partner or partners would be my advice to folks who want to work with marginalized populations, or an amazing set of friends. I have that as well. Some of them I suspect may be listening in. And they, you know, have great things like taking me out to concerts and restaurants and all sorts of fun activities, and that really makes a difference. So definitely find your people. I think they're going to have your back, and certainly my people have had my back. But what I would say, sorry, I'm off track. For folks who, I'm not off track, but getting back to the meat of the point, if you're going to work with marginalized populations, I would say we have to stop trying to fit marginalized groups into treatment models and to systems that were not created for them. You can't build a model for straight, white, cisgender people and expect it to fully address the experiences of everybody else. And, you know, sadly, a lot of the literature has been just focused on disparities and ways in which marginalized populations aren't succeeding in the system that wasn't built for them, whatever system that is. And, you know, one of the sets of papers that I'm really most proud of all the publications are ones that I've co-authored with some junior colleagues. And what we have been doing is trying to offer a new conceptualization of trauma recovery that includes minority stress as part of the model and helps us understand the distress that people are having that accounts for the minority stress experiences as well as the trauma. And in doing that work, we've included the voice of the people that the models are being developed for, which I think is really essential. And I'm really hopeful that we're going to be able to build new systems of care that are effective for marginalized communities because it includes their voices and their experiences as part of the model.
And
Oh, good. You have them up.
I'm
Yeah.
just showing a few of these
Yeah.
citations because, I learned by reading, and I'm assuming that many folks in our audience tonight are kind of built the same way, right? That by reading about a patient-centered model of mental care for trauma and minority stress, we can start to think about what we're doing and start to think about ways that we need to get rid of stuff that simply isn't working and listen to the groups that we're working with for what do we do instead, right? So that's the question. What do we do instead? How can we make this work for you? Um, and I think that I'm going to stop sharing here. I think that anybody who wanted those references probably took a picture of that. So,
Or they can just reach out. I'll send them. I'll send them the papers.
of course you will. Of course you will. Um, I see a question in the Q&A, but I'm going to ask you one more before we get
Okay.
that. It's actually
Okay.
a really nice question. You've received this award for the impact that you've had in transforming the VA healthcare services. How do you view your impact? I know how we view your impact, but how do you view your impact?
Mm. Honestly, my work is only a start. I love that I've been able to be a pioneer in this space, but there is so much more to do. And, because I work with marginalized communities, real impact would mean that I've made my job obsolete. Really in some ways there's more to do now than when I started. It's actually gotten more complex because it used to be that I could just explain to people sort of the facts of health disparities for LGBTQ plus folks and the importance of making change to improve the health and well-being of LGBTQ plus veterans. And folks saw the logic of that and changes went pretty quickly. But these days, we're experiencing tremendous pushback about the rights of LGBTQ plus people to live happy, healthy lives. And honestly, in my personal opinion, I see that folks have very strong feelings that LGBTQ plus people don't have a right to healthcare or bodily autonomy. And we're seeing legislation, as you referenced, in many states that are stripping rights away from patients and providers,
Right.
not based on data, but based on feelings or personal objections. So I honestly think that this work is getting much harder for the next generation. And also, I'm really confident that they're up to the challenge. Um, Fortunately, again, in VA, we have policies that make it very clear that LGBTQ plus people should have access to affirming care in every state, even states that restrict care, because of our federal policies superseding those local policies. And of course, the culture is different at each VA, and providers and patients who live in states with bans on transgender care in particular, I think are rightfully so scared. And we need to be doing more to support providers who continue to provide care. VA does a really great job with that, but I think a lot of organizations could be doing better with that. And we need to do more to make sure that veterans feel safe at VA. I think we need to do more as a community to make sure that LGBTQ plus people feel safe in general. And so definitely that's something that I have a commitment to. And hopefully others on the call do too, because it's going to take all of us, not just people who are in the LGBTQ plus community, but folks who aren't as well, to really make change.
So I know I said one more, but it's actually two. And that was the first part. Let's put
Oh
it that way.
boy. Okay.
Yeah. When you think about psychology, right, the field of psychology, how do you define impact?
Impact means that you have made the world a better place. That's what it means to me. I want to leave this world better than I found it. That if I could do that, then I've made some impact.
Well,
That's
I think I think you've done that. Even if you feel like your work has only started, I think you've definitely done that, Jillian.
thank you.
Um, and I think all of us at APF totally think you've done that because that's what you got this gold medal award for. So, anytime you're laying awake at night wondering about if you made the world a different place, I think the answer is you totally have. So don't stop, but
There's too much to do. I'm
there
not gonna
is too
stop.
much to do. We've got a great question
Mm,
from Jessica, who says, what can a psychologist who's not in the VA learn from the VA, and what is available outside the VA?
that's a great question. So what can you learn from the VA? Well, hopefully there were some helpful tips here about ideas that you can take back to your institution, wherever you are, in terms of making change. So the VA in has a great website. LGBTQ plus health has a ton of fact sheets and training materials that are all available publicly. There is also, so we have an online education system that's inside the VA for, I was referencing a bunch of trainings that we offer in terms of gender affirming care and how to do sexual health assessments and those kinds of things, all great trainings. And the cool thing is they're not just available inside the VA. They are available free on a platform called VHA Train, TRAIN. And so lots of organizations put their trainings up there, and VA puts their trainings up there as well. So all those trainings that we offer inside the VA are available outside the VA as well through that platform. So you can access those trainings for free. You just need to, create an account, a login account. And a lot of our trainings also have continuing education credits. So that's another little bonus. So yeah, so there's fact sheets, there's videos, there's training material. So please have at it.
I had no idea that I knew that some of what you helped create was publicly available, but how marvelous that all of these training videos and all of the rest of it that I thought were kind of behind the little VA firewall are actually accessible to folks outside of the VA.
Yeah, that's your tax dollars at work.
Well, I'm glad to hear that. I think this is really critical information. And as LGBTQ plus people are feeling more support in some environments, I can envision that they wander into a psychologist's office and ask about gender affirming psychotherapy. And I think that clinicians, no matter where you work, really need to understand the broader picture.
Yeah,
Um, it's not just helping someone deal with minority stress. It's not just talking about, how do you tell your family that you're transitioning? It's not, there's so much more.
right.
Um,
Yeah.
so this is, I think, critical, and I'm delighted that our taxes are actually making resources available for um, professionals who want to be up to date and providing high quality care.
Yeah, yeah. And we have, Pride Month is coming up in June for most of the country. And so when you're thinking about, oh, I need some continuing education credits, because for a lot of us, it's also that time of year where we're renewing our licenses, this is another option for you to get some more training. And I'm hoping folks will continue to put questions in the chat. These questions have been great. They've helped bring out some good information. And Gayle, I know you like to embarrass me, so we can talk about another mistake that I made if you want.
I don't like to embarrass you. It's just,
Just a little
we've been
bit.
friends for a long
I
time,
know, I know. I don't mind. But it's sort of, my mistake sort of dovetails with this public resource as well. So back in 2011, I made a big mistake. And that was when we passed the first national policy in VA on transgender care. So healthcare in the United States is guided by what's covered in your medical benefits package. And for most of us, it's, our health insurance medical benefits package. But in the VA, we have a medical benefits package too. And your medical benefits package says what's covered and what's not. And, since the early 90s, the VA medical benefits package had listed gender alterations, just those two words, gender alterations, as not being covered care. And in 2011, when we made that first VA policy on transgender care, what we decided to do is to narrowly define gender alterations to mean just surgical interventions for gender affirming care. And at the time, that seemed like a really good decision because it meant that then we could provide hormones and mental health care and support groups and vocal coaching, like we talked about, and lots of other kinds of care to transgender and gender diverse veterans pretty quickly. And, instead of undergoing a whole rule change process to get rid of that exclusion. And at the time, it was a pretty big win and it was cutting edge that we did that. But now, in retrospect, 2020 hindsight, I believe we sacrificed comprehensive care in favor of the easier win. And this is just my personal opinion. But this battle to provide comprehensive care to transgender, and gender diverse folks in the VA is ongoing. And I just want to say it's my personal goal to make sure that all veterans have access to the medically indicated care that they have earned. And when we're able to do that, I won't say if, when we're able to do that, it's going to be on that website that you saw. That I put forward, the www.patientcare.va.gov/LGBT.
So many veterans have performed some of the worst service for this country, worse in terms of just the awfulness that they've been exposed to. So I am really, really grateful, Jillian, for your sharing time with us tonight, and sharing your extraordinary work. We are so grateful for your advocacy, your vision, the clear, focused passion that has made healthcare so much better within the VA healthcare system for LGBTQ plus veterans. It's remarkable. Your impact is remarkable. And I know you're not done. I mean, I just know you're not done. So thank you so much for taking an hour when you could have been, I don't know, changing the world in new and different ways, very, very grateful for your time.
Oh, I'm thrilled to have been able to do this tonight, and especially to have you to do it with. It's been kind of a full circle moment, and I'm just so grateful to have you to be able to be here with me. It's such an honor to be among the amazing group of people who received awards. I was very fortunate to get to see all of their fireside chats. And I want to encourage people to check out those fireside chats because I know they were recorded. They were phenomenal, and they also made me very nervous because they're all outstanding humans. And so thank you for being with me and being a friendly face to have this conversation and keep my anxiety at bay.
Well, it's been fun. And we do have a comment in the Q&A that's not a question. It simply says, wonderful conversation from Lynn.
Oh, that's
So, yeah. So with that, I think we are ready to wrap. Thank you, audience, for tuning in tonight. We've enjoyed, hopefully, giving you a way to understand Dr. Shipherd and the remarkable changes that she's implemented in the VA.
Thank you, everybody.